Hello and welcome to this special broadcast. I am Priyadarshini Medhi and today we are going to discuss about knowledge and awareness on IVF. So, IVF, which is known as in vitro fertilization, is a complex series of procedures used to help with fertility or prevent genetic problems and assist with the conception of a child. So, we all know that IVF has become very common nowadays, isn't it, viewers? So, what is the process and does it have any side effects to the body? To discuss on all this, I have with me Dr. Ratul Dutta, renowned gynecologist in Guwahati. So, first of all, I would like to ask Dr. Ratul Dutta, so what is IVF and what do we understand by IVF, doctor?
IVF means in vitro fertilization. That means fertilization not inside but outside the human body. Normally fertilization happens inside the human body. Normally the egg is released from the ovary, then sperm meets the egg, then fertilization happens in the tube, and that fertilized ovum gradually goes down into the uterine cavity and that pregnancy grows. But this situation doesn't always happen, for which a patient remains infertile. So, the procedure where this fertilization process is done outside the human body, that means inside the laboratory, that is called IVF or in vitro fertilization. So, what is done? In IVF, in the laboratory, both eggs and sperms are collected, embryo is formed, and finally that embryo is pushed inside the uterine cavity and patient gets pregnant. So, in general term we call it IVF. This is the IVF. In general term, IVF is also called test tube baby. Test tube is a symbolic name. Test tube indicates something that's done in the laboratory. So, baby is created inside the laboratory. So, that symbolic term is being used as test tube baby, which is actually in vitro fertilization or IVF.
So, doctor, why couples have to undergo this procedure to have a child?
Normally, we allow the patient to have pregnancy by natural way. We ask them to try naturally. In some cases, we ask them to try them by taking some medicines. In some patients, we tell them that you try this procedure, that is called IUI, intrauterine insemination. That is a simple procedure. If all those procedure fails, then we ask the patient to undergo IVF. But in some certain situations, IVF should be advised to the patient directly without undergoing through these processes, or where these previous processes fails, then we have to undergo for IVF treatment. There are some indications or there are some conditions where IVF treatment is the treatment for having a child. Say when tubes are blocked. It's called bilateral tubal blockage. When both the tubes are blocked, then IVF is the only answer to get a pregnancy. Because to have pregnancy, both tubes or one tube has to be open so that sperm and egg can meet. But when both the tubes are blocked, then there is no other way than doing a test tube baby. That means in vitro fertilization or IVF. Because this embryo has to be created inside the laboratory and it has to be put inside the uterus. Because in normal circumstances, it cannot meet since tubes are blocked. So, that is one indication where IVF is a must. Secondly, in unexplained infertility, that means in certain patients, infertility cannot be explained. Apparently, all factors are normal, tubes are normal, husband's semen parameter is normal, patient is ovulating. In spite of that, patient is not getting pregnant. Or many a times IUI treatment is being done. If in doing IVF treatment also patient has failed to conceive, in those cases also in vitro fertilization or IVF is done. In certain cases of severe endometriosis is a condition where the anatomy is distorted, where the ovulation process is disrupted, when tubal function is disrupted. So, all the process of fertilization is hampered to some extent by this disease. In severe endometriosis, the IVF procedure is undertaken and that gives many times a very good result. In some patients, husband's semen parameter is very weak even in some patients there is no sperm at all. In those cases also IVF is done. The patients or husbands who cannot who cannot give semen by natural way or by artificial way, you cannot give the semen sample. In those cases, sperm is collected from the testicle or from the epididymis. If sperm parameters are very low, sperm parameters mean we know the count of the sperm. There should be a minimum number of count of sperms. If that number is less, or the movement of the sperm is less, or the structure of the sperms are less or bad, in those cases fertilization is hampered. In those cases, ICSI procedure is done, a different technique that I will explain later on. So IVF ICSI is done to help those couples. So when there is no sperm in the ejaculate, then we collect the sperm directly from the testes, we do IVF and patient may get pregnant. When the semen count is not sufficient to produce a baby, if count is very low, as I told you, if the movement is less, if the morphology is bad, in those cases also IVF treatment helps having a baby. Then some other conditions like some cases of PCOS, not all cases of PCOS, where there is ovulation disorder, where after attempting simple attempts ovulation doesn't happen. In certain cases IVF treatment is required, where medicines are used, eggs are being produced, those eggs are collected and finally IVF is done. So in nutshell, these are the very common indications where IVF is being done.
So doctor, what is the procedure of doing IVF?
In IVF, what we do, we stimulate the patient's ovaries to produce number of eggs. Normally, in normal circumstances, 1 or 2 eggs are produced, but here we want more number of eggs. So injections are given to the patient so that multiple eggs are formed. So after the eggs are formed, giving daily injections almost 10 to 11 days, we see the eggs are growing. When eggs are mature, then eggs are being collected under anesthesia from the patient's ovary. Patient is taken to the OT, given anesthesia, and with under ultrasound guidance, eggs are collected by aspirating the eggs by needle, and it is collected in the petri dish. At the same time, the husband's sperm is collected and that is processed and semen preparation is done. Then finally, both the sperm and eggs are treated in the laboratory. In the incubator, it is kept. Both the sperm and eggs are united. In the petri dish, media is added, then it is put in the incubator and fertilization allowed to happen. In certain circumstances, ICSI procedure is done where the egg is fertilized by a single sperm. Following that, again it is incubated in the incubator. Finally, embryo is produced, and that embryo is either freezing is done or that embryo is put in the patient's uterine cavity. So in nutshell, this is the procedure of doing IVF. Means we stimulate the patient for egg production, collect the eggs, collect the sperms, treat it inside the laboratory, we create the embryo and put in the incubator, or we put inside the patient recipient's embryo, uterus.
So doctor, can you please tell our viewers, what is the success rate till now?
The success rate of IVF is normally 30 to 50% in general. If some couple try, if a normal couple try for pregnancy, the success rate is around 10 to 12% in one particular treatment cycle. If intrauterine insemination is done, if IUI is done, then success rate is around 15 to 18%. But if we do in vitro fertilization or IVF, the success rate is around 30 to 50%. It depends upon patient condition and depends upon mostly the patient's response to the IVF treatment. So it's a good number. It varies from patient to patient, but in an average, we see that 30 to 50%. In some situations, it go even up to 60% also. So this is the amount, the percentage, overall percentage of success rate in IVF.
So what is the appropriate cost of the treatment? So how much is it? Does it cost?
The cost of treatment varies from center to center. it varies from individual to individual. It varies from the protocol or procedure used by for the patient or by the center. In average, for one cycle of IVF, the cost is around 1,20,000 to 50 to 60,000, or 1,20,000 to 1,50,000, or 1,60,000. There are some centers who are offering some in reasonable price also, even below that. But on average, most of the centers are doing IVF in that rate.
All right, viewers, now it's time for a very short break. We'll discuss more on IVF awareness after this short commercial break. Stay tuned. Welcome back to this special broadcast. Well, today we are discussing on awareness and knowledge on IVF. So, as I've already mentioned, that IVF, which is known as in vitro fertilization, which is a complex series of procedures used to help with fertility or prevent genetic problems and assist with the conception of a child. So, as I've already discussed, that IVF has become very common nowadays, and the couples who are they are planning to undergo this treatment, the IVF treatment, they should immediately consult a gynecologist. And today we are having a discussion on IVF. I am sure this will be very helpful for all the couples who are planning to undergo this treatment. Well, there are many, every procedure has benefits and side effects. So now today we have with us the Dr. Ratul Dutta. We were discussing on various knowledge on IVF. So now I'm going to ask Dr. Ratul Dutta. So doctor, what type of problems faced by the couple or by the treating doctors while carrying out this procedure? Because both the couples and the doctor, they face some kinds of problems while carrying out this procedure. So what kind of problems do they generally face?
As we know, all procedures has some good effects or some bad effects. Likewise, IVF treatment also has got some problems. The patient or patient may face some problem while doing the IVF procedure. Like it's a surgical procedure. It's a procedure where patient is given injections, eggs are being produced. Sometimes after giving very high quality of high doses of medicines also, eggs are not formed. So you can consider that is a problem. Sometimes apparently eggs are formed. We see eggs are growing inside the ovary. We see in ultrasonography, but while you take it out, we aspirate, we see that the good quality of eggs are not inside. Only less number of good qualities of eggs we see inside. So that is one problem you can say. Sometimes apparently we see good eggs, good sperm. In spite of that, they are not fertilized. There is fertilization failure. So that may be one problem. Sometimes in spite of fertilization, there is no good embryo is formed. That may be a problem. Sometimes there are some other problems are there. Since it's a surgical procedure, we put a needle inside the abdominal cavity. Through the vagina, there is sometimes bleeding may happen from the vaginal vault. Of course, those are not difficult to manage. It is simply it can be tackled by applying pressure. Sometimes bleeding from the ovary also happens. Sometimes in some cases an infection may happen. So these are some problems patient may face, but the chances of these problems are very less. If we assess the patient very correctly, if we do the investigations very thoroughly, then these problems can be averted. But there are some problems we cannot do anything about that, as I told you, like fertilization failure, like quality of oocyte. Sometimes we cannot do anything about that. So you can say those are maybe the problems of doing IVF. But we have to balance between the problems and good side and bad side. And those who need IVF, they have to undergo IVF. And if we do in a correct way, taking all precautions, many of the problems can be avoided.
So there is a term in IVF, embryo freezing, isn't it? So what is actually embryo freezing while going through this procedure of IVF?
Embryo freezing means we can freeze the embryos inside the inside our can. normally we get number of egg. When we get number of embryos, then we don't transfer the embryos in the same sitting. We freeze the embryos and we transfer the embryos in a different cycle. So we freeze those embryos applying some special technique and using some special media, freezing media. We put the embryos inside the laboratory. We keep it inside the laboratory in a different specified tank where the embryos can be preserved for many years. So whenever a patient desires to undertake the transfer, want to accept the embryo, in that case, again it is taken out from the tank, it is defreezed and it is cultured, then it is put inside the patient's uterus. So embryo freezing means we keep the embryos in a frozen condition where it can be kept for many years, and when it is desired and when it is planned to transfer inside the patient's uterus, then it is again taken out and transferred in patient's uterus. This is embryo freezing.
So, doctor, my next question to you, what type of special IVF procedure is undertaken for absent or very low sperm parameters in men?
Many times patients come to us where husband say that he doesn't have any sperm or he has got very low quality of sperm. What can be done? So, to do IVF, to do conventional IVF, a definite number of sperm, definite quality of sperm is required for in vitro fertilization. That means in conventional IVF, we allow the egg and sperm to unite themselves. We put both sperms and eggs together in a dish and then normally fertilization happens. But it requires some minimum number of sperms. It requires minimum quality of sperm. Where those quality is not there, say where there is severe sperm defect or there is severe less number of sperms, that procedure, the conventional IVF procedure doesn't help. In that case, the ICSI procedure is done. In the ICSI procedure, a special equipment is used where one egg is taken and one sperm is taken, and each sperm is injected into its egg, and that procedure is called ICSI. Or in other words, we can say ICSI procedure is a procedure where IVF or patient can be pregnant with the technique of ICSI, where the sperm parameters are very low or absent in the ejaculate. But sperm must be produced inside the testis, it must be being produced inside the testis because it has to be taken out from the testis. So this is the ICSI procedure.
So doctor, when the IVF is done, I'm sure the first attempt is not always successful. So after many attempts, the procedure is correctly done, isn't it? So what is done when one IVF attempt is failed? So what is the next step do the doctors do?
As we know that success rate is not 100%. If we try, then it will be 100% success. It is not like that. We have already told that it is success rate is around 30 to 50%. So 70 to 50% patient will fail. So what to do about that? If one cycle is failed, definitely reassessment is done. We have to see why patient has failed or what may be the cause of failure of the first attempt. Sometimes other vigorous investigations is required to find out the cause of failure, and sometimes some corrective procedures and some medicinal treatments are given prior to the next embryo transfer, by which implantation will be successful or implantation failure can be prevented. So when one attempt fails, definitely subsequent attempts can be made. There is no any number that the patient can try. That is, patient can try once, if one fails, and again they may try. So number of times they can attempt, and when number of times I attempt, definitely success comes.
So, doctor, my last question to you. Well, we all, many people, they think that the babies which are born through this procedure, are they different from the babies, who are born naturally? So is there any different from, is the IVF born baby, are they different from babies born by natural conception, or is it a myth?
Since first test tube baby was born, since then many years have been crossed, more than 25 years, 5 years has been crossed. And across the world, this is a area of study for all scientists. What about the baby? What about the condition of the babies? Those are born by this IVF treatment. So these studies shown that there is no difference between the baby born naturally and baby born by test tube baby. So incidence of problem, incidence of baby defect or whatever problems we see, that is not different from the normal population. Normally 1 to 2% cases there is some congenital abnormality happens in the babies, even in normal population. That may happen in the IVF babies also. But the statistics is same for normal baby and baby is born by IVF treatment. So we can say that baby is born by IVF treatment has got no any other defects. They are as good as a normal baby that is born by an IVF procedure.
So, all right, viewers, so with this, we have come to the end of this special broadcast. I hope this will be very beneficial for all the couples who are planning to undergo an IVF treatment. And as you've already listened to this discussion, well, IVF treatment is not any different. It's it has become very successful nowadays. And the couples who are, planning to start their family, you should go and see the gynecologist because the babies which are born through IVF is as normal as the babies who they born naturally, isn't it? So thank you so much, Dr. Ratul Dutta, for joining me on awareness and knowledge on IVF. Thanks for watching.